My name is Irina Ilanji, and I'm a dental hygienist at Chas. A dental hygienist is a licensed healthcare provider. We work with the dentist to prevent and treat oral disease. As a dental hygienist, we clean patients' teeth, we take x-rays, we administer anesthetic. We can also put on fluoride and sealants on patients. I decided to become a dental hygienist because I was looking for a career that's challenging, that's interesting, and that gives me an opportunity to help other people. As a dental hygienist, you also get a really competitive salary. Also, as a hygienist, you can choose to work part-time or full-time, so you can customize your schedule to maintain a healthy work-life balance. To get to this position, I graduated from high school, and then I took about 2 years of prerequisite work at Eastern, and then I applied to the EW Dental Hygiene program. This program is also about 2 years, and I got my bachelor's degree. And after I graduated, I also had to take national boards, pass clinical exams, and become licensed. So my experience at Eastern was both rewarding, also challenging. So in the program, there are difficult courses that you take. It also requires a lot of your time. You can expect to be in school or in clinic from 8 to 5 every day. So it helps if you treat it as a full-time job. However, because you are spending so much time with patients in clinic, once you graduate, you can start working right away. So you don't need to do any clinicals or residency after graduation. I would describe EW program as comprehensive. So it doesn't just teach people how to clean patients' teeth. They focus on the overall health of a person. During the 2-year program, you learn about different factors that affect a person's oral health. So you learn medical conditions, medications, nutrition, and other factors. In a typical day, here at Chas, we see about 8 to 10 patients a day. We get a 30-minute lunch break. If patients don't show up, then I will help the dentist with administering anesthetic, doing fillings, or helping out in sterilization. I usually arrive to work 30 minutes before, so around 7 o'clock, and I'll set up my room, I'll look over my patients for the day. Once I do get to see my patients, I seat them down and then I'll go over their health history. I take some x-rays, we do an exam, and then I jump into the cleaning. So as a dental hygienist, you do need to be skilled in the clinical setting. You need to be able to use the instruments properly, take good x-rays, and then help patients manage their pain. Also, you need to have people skills. So when we treat patients, we talk to them. We spend an hour with each patient, and we need to be able to make them comfortable in our chair. Additionally, you do need to have certain personality traits, such as being compassionate, being flexible, and staying positive. I would say one of my best moments in this career is getting praise from a patient that had severe dental anxiety. I had a patient that she hadn't had a cleaning for about 10 years and her gums were severely infected, but because she had high dental anxiety, she wasn't coming in earlier. So when I saw her, I kind of talked to her throughout the appointment. I tried to make her as feel comfortable as she could. I also got her really numb so she wasn't feeling any pain. So it was awesome to see her come back, to see such great results, and then she thanked me that she was able to come back to dentistry. I love my job because every day is different. We see numerous patients with different personalities. In addition, I have really great coworkers, and I also feel like I'm making a really big difference in our community here in Spokane.